Hi everyone. So this class we will discuss on the various applications of monoclonal antibodies. So the applications of MAbs are broadly classified as diagnostic application, therapeutic application and the protein purification. The diagnostic and the therapeutic applications are the most important among these three. What are the various diagnostic applications? Which includes the use of monoclonal antibodies in biochemical analysis and its use in the various diagnostic imaging. So first let us see the use of MAbs in biochemical analysis. It is used for the pregnancy testing. The MAbs that developed could detect the human HCG, and this type of monoclonal antibody containing pregnancy kits are available in the markets. Secondly, it is used for the diagnosis of cancers, especially the estimation of plasma carcinoembryonic antigen in the colorectal cancer and in prostate cancers. Apart from the diagnosis, the estimation of tumor markers is also useful for the prognosis of the cancers. Third, it is used for diagnosis of hormonal disorders, especially analysis of thyroxine, triiodothyronine, and thyroid stimulating hormones. So estimation of this or analysis of these hormones can be dictated with the help of monoclonal antibodies. Fourth, it is used for the infectious disease detection. So infectious diseases by detecting the circulatory levels of antigens specific to these infectious agents. So each type of infectious agents may be producing specific antigens. So these antigens may be determined with the help of antibodies. Example is antigen of Neisseria gonorrhea and herpes simplex virus for diagnosis of sexually transmitted diseases. Next one is MAbs in diagnostic imaging. The radio-labeled monoclonal antibodies are used in the diagnostic imaging of diseases, and this therapy is called as immunoscintigraphy. The most commonly used isotopes includes iodine-131 and technetium-99. So the monoclonal antibodies tagged with radioisotopes are injected intravenously into the patient for the imaging. So first of all, it is used for imaging the myocardial infarctions. The cardiac protein myosin gets exposed wherever myocardial necrosis occurs. So in case of myocardial necrosis, the myosin gets exposed. Anti-myosin monoclonal antibody labeled with radio-labeled isotope of indium chloride is used for detecting myosin and the site of myocardial infarction. So after administration, the monoclonal radio-labeled antibodies is usually done after 24 to 48 hours after the administration. So, as a result of the myocardial necrosis, the myosin gets released and the myosin is detected, and the site of myocardial infarction is also detected by administering anti-myosin monoclonal antibody labeled with indium chloride, and the imaging of this can be done after 24 hours of administering the radio labeled monoclonal antibody. Second, it is used for detecting or imaging deep vein thrombosis of DVT. So this refers to the formation of blood clots within the blood veins, especially in the lower extremities. So for the detection of DVT, the radio labeled monoclonal antibody directed against the fibrin or platelet can be used. In other way, the radio labeled monoclonal antibody that can bind with the fibrin or the platelets can be administered. So upon injecting such type of radio labeled monoclonal antibody, after 4 hours of administration, the imaging can be performed. So the fibrin specific monoclonal antibodies are successfully used for detection of clots in thigh, pelvis, calf and the new regions. Third, atherosclerosis. The thickening and loss of elasticity of the arterial walls is referred to the atherosclerosis. The plaque-caused disease of the coronary and peripheral arteries. So the MAbs tagged with a radio label directed against activated platelets can be used to localize the atherosclerotic lesions by imaging technique. So the MAbs radio labeled upon injection, which can bound with the platelets, which helps to detect the location of or atherosclerotic lesions by imaging. The next one is imaging of the cancer cells. So MAbs are used for detection of many sort of human cancers. The tumors located in patient using the radio labeled MAbs are specific to the proteins. MAbs in immunohistopathology of cancers. The pathological changes of the cancerous tissue can be detected by immunohistochemical technique. This can be done using MAb against a specific antigen. The MAbs in hematopoietic malignancies. The hematopoietic stem cells in the bone marrow are the precursors for different blood cells, beta and T lymphocytes, which are produced in the stepwise transformation. So during the malignancy, the transformation of lymphocytes stops at a particular stage of maturation. So this is detected with the help of monoclonal antibodies. So this way it helps in detection of hematopoietic malignancies. Then imaging of bacterial infections. So this is done by injecting MAbs against the bacterial antigens. Apart from that, it can also be directed against the inflammatory leukocytes which accumulate at infection site. Also, it is useful to specifically detect the localized infections. So these are the diagnostic applications of monoclonal antibodies. The next is the various therapeutic applications. Direct use of MAbs as a therapeutic agent is possible. At the same time, MAbs are also used as the targeting agent. That means the MAb itself can produce the therapeutic activity, or MAb is used as a carrier for the transport of the drug molecules. MAbs as the direct therapeutic agents. So this MAbs helps to enhances the immune function of the host. So direct use of MAbs cause minimal toxicity to the target tissues or the host. MAbs promote efficient opsonization of the pathogenic organism and it enhances the phagocytosis. In this way, it destroys the disease causing organisms. So, like the naked MAbs, it directly produces the therapeutic activity. It can be used for the treatment of cancer. MAbs against the antigens on the surface of cancer cells are useful for the treatment of cancer. The antibodies binds to the cancer cells, destroys them. It is used in the immunosuppression of organ transplantation. In the normal medical practice, immunosuppressive drugs such as cyclosporine and prednisone are administered to overcome the rejection of organ transplantation. So monoclonal antibodies specific to T lymphocyte surface antigens are being used for this purpose. So the monoclonal antibody, namely OKT, is first licensed by the US FDA. It is again used for the treatment of AIDS. So usually in AIDS, the immunosuppression occurs caused by reduction in CD4 cells of T lymphocytes. The human immunodeficiency virus binds to the specific receptors on CD4 cells by using surface membrane glycoproteins. So this can be inhibited with the help of monoclonal antibodies. It is again used for the treatment of autoimmune disorders like rheumatoid arthritis, multiple sclerosis, etc. So the monoclonal antibodies direct against the T lymphocytes and B lymphocytes to treat the autoimmune disorders. Next, monoclonal antibodies as targeting agents in the therapy where this act as the carriers. The toxins, drugs or the radioisotopes can be attached or conjugated with the monoclonal antibodies to target the affected area. The higher concentration of drug to reach the desired site with the minimal toxicity. This way, the MAbs are used as a targeting agents. MAbs are also used as immunotoxins. The toxin can be coupled with monoclonal antibody to form immunotoxin and is used in the therapy, especially in the cases diphtheria toxin, Pseudomonas exotoxin, toxin used for the cancer treatments. Next is MAbs in the drug delivery. The drugs can be coupled with MAbs and this MAbs can specifically bind with its site of action. MAbs in the dissolution of blood clots. A great majority of death occurs due to blockage of coronary or cerebral artery. The tissue plasminogen activator can be used as a therapeutic agent conjugated with the MAbs to remove the blood clots so that it can directly act on the target site. Drug delivery through liposomes coupled to tissue-specific MAbs. Liposomes are sacs or vesicles formed spontaneously when certain lipid molecules are exposed to aqueous environment. So these drugs entrapped inside the liposomes are coated with monoclonal antibodies which direct against the specific antigen which is being tried for the drug delivery. Next is MAbs in radioimmunotherapy. The radioisotopes can be coupled with the MAbs that are directed against the tumor cells. This allows the higher concentration of radioactivity at the desired site and a very efficient killing of the target cells. The last one is the protein purification. The monoclonal antibodies can be produced for any protein, and so produced MAbs can be conventionally used for the purification of protein against which it was raised. The immobilized monoclonal antibodies in this manner are very useful for the purification of protein by the immunoaffinity method. So these are the main three applications of monoclonal antibodies. Okay, thank you so much.